Hi there, I'm Dr. Hillary Heschauer from Rangeline Chiropractic. Today we're going to do some question and answer in a fun style that I love with my little spinning wheel. So we've had some people pre-populate and ask me questions. So I've got them in this little bowl here. And I'm just going to read them, answer them, and then I'll spin the wheel. You don't have to be present to win. I will contact you when you've won something. So let's pick this first one. Michelle wants to know, what is the difference between dry needling and acupuncture? Great question, Michelle. I get this question all the time. So in our office, we do dry needling. Dry needling is to help tight muscles relax, as opposed to acupuncture, where the acupuncturists are using different meridians of the bodies and presets, like points on the body for whatever the ailment is. So with the dry needling that we do in our office, it's just for tight muscles. So if I find that you're tight in your upper back, I'm going to stick a needle into that tight point. And then an acupuncturist might have other points that they use for like upper back tightness. So great question, Michelle. A person doesn't need to be an acupuncturist to do dry needling, but there's a certification program that I went through years ago to become certified to dry needling. However, I am not an acupuncturist, so just clarifying that. So let's spin and see what Michelle wins. I also love the clicking noise of this. I hope you guys can hear it. It's pretty exciting. Uh-oh, she's got a purple one. That one's a special one. I will reach out to you, Michelle, and let you know what you want. Okay, next question. And then if anyone's watching wants to make a comment below and have a question, I will answer that first too. Okay. Mandy wants to know, what are great ways to get rid of stress? Perfect question for this time of year, Mandy. So obviously we've heard of things like going for a walk and journaling, getting the right food and water and exercise and getting enough sleep. I mean, how many of us don't get enough sleep? I've been guilty as charged on that one. So it's a stressful time of year. It's been a stressful year and 3/4. So learning the best way for your body to manage the stress. It could be talking to someone. It could be exercise. It could be getting out of the situation that's causing you stress. I like to joke and say oh yeah, just stop the stress stuff. When my patients are like, oh, I'm so stressed, I think that's why my neck hurts and I have headaches. I'm like, oh yeah, you should definitely stop that. That will totally help. But it's like a little joke. Like, we know that stress is going to be around us. We just need our bodies to manage it better. And sometimes that's like mentally managing it better, physically managing it better. Chiropractic actually helps with your nervous system to allow your body to deal with stress on like a chemical, physical, emotional level better. So that's a little hidden fact about chiropractic, is how well it can actually help with stress and mood and depression too. So Mandy, thank you so much for asking. We're going to do the spinning and see what you won. I'll try not to spin it too hard this time. That way it actually stops on something. Oh, you get a gift card from us at Rangeline Chiropractic. Awesome. I will reach out to you, okay? Next one. Caitlin, she wants to know, do you work with pregnant women? Yes. I love working with pregnant women, Caitlin. Thank you for asking. I feel like that my pregnancy was like one of my favorite moments. Well, both the pregnancies, my favorite moments in life. I just loved being able to grow something inside of me. And so when we have pregnant women that come in, I'm just so excited for them to get to go through that process. So right now we have about 10 pregnant women in our office, and one delivered last week, one delivered the week before, and then another one, 2 of them last month. So we're constantly having a lot of new patients come in that are pregnant. Any stage of the pregnancy, there's different things that we do to make sure it's safe for you and the baby. There's a procedure, it's called the Webster technique, and that is a different technique just that we do for pregnant women. It loosens up the pelvis, like the round ligaments in front. I can help with pressure and acid reflux and tightness around the belly. So there's a lot of different extra things we do with pregnancy and with the Webster technique. So great question. Thank you for asking. We also have these large pillows that have like a big dip in them, and then when you're laying on your stomach, your belly sits in it and it keeps you propped up so you're not on your belly. So patients love that. They're like, I just want to take this home and sleep on my stomach like that. So we always joke about that, like, yes, you have to finally get up off the table. So yes, most insurances cover chiropractic care for pregnancy too. So it's great. I don't even know how people go through pregnancy without chiropractic care, because I felt like it made such the biggest difference for me in my low back and sciatica and like pelvis. And then I have a lot of patients right now with acid reflux that we're working on during their pregnancy too. So thank you so much, Caitlin, for asking the question. And I'm going to do a little spinning wheel. Caitlin, you win Starbucks. I am going to reach out to you. I'm writing it down right now to reach out to you, and I'll grab your information and send you a Starbucks e-gift card. Okay, we've got 2 questions left, unless anyone wants to hop on. We've got Sabrina. She said, what are the causes of a subluxation? Well, she has 2 questions. Okay. So a subluxation is the term we use when the bone is like out of alignment and is pushing or irritating a nerve. When the nerve is irritated, then we get like pain, tightness, or we get organ difficulties such as acid reflux. So what causes that? I would say the number one cause that I see lately is stress. So stress being like chemical, mental, emotional stress. It's crazy what the body can do under stress. I think we all understand that. Lately, I've been having a lot of like physical trauma type issues, like patients that have fallen, especially kids lately, and auto accidents. So something traumatic like that. And think of another stress even as like chemical stress. So like you eat foods that you shouldn't because you're allergic, or you're on a lot of medication for something, or too much alcohol or drug use. Those are still like stressors to the body that can cause a subluxation. So thank you so much for asking that, Sabrina. That's something I don't talk about a lot, and I always find it fascinating, and then I realize not everyone knows that. She says, if I feel good, I must be fine, right? I wish. Even I don't know when I have a subluxation or like a misalignment in my spine. I might feel like tight, but I definitely don't wait until I get in pain. And so I actually have Dr. Taylor here at the office. I have her check me weekly just to make sure I'm doing well. Most of my patients, I suggest, depending on what they have, like if I'm checking them every week, every 2, 3, 4, 5 weeks, just to see what's going on before they walk in going, oh my gosh, I'm in so much pain. And I think, yeah, where have you been the last few weeks when the tightness started? You can't necessarily feel when a subluxation occurs. And so most of us, we wait until we have pain. The step right before pain would be like tightness, or lack of motion, like, oh, I just can't turn my head all the way. Oh, hey, that's a good indicator that there's something wrong before all of a sudden you wake up in pain and you're like, I'm in so much pain, I can't move my neck. So pain is actually like the last symptom to appear. And unfortunately, it's the first to leave. So then when the pain goes away, we go, we're fine, right? Like we're good. But actually, it's just not true. Think of it too like a tooth issue. You know how like it doesn't just like crop up that day and all of a sudden it's so bad you have to have it pulled. It goes on for a while, and that's why we get like checks on our teeth, right? And they do x-rays to see what everything's looking like. It's more of a preventative thing too. Sabrina, thank you so much for asking. Okay, Sabrina, you are going to get a gift card to our office, and I will reach out to you. Okay, last question that I have. Vicki wants to know, can getting a spine adjustment help with lower back pain? Absolutely, Vicki. That is our top reason that people actually come in to our office, and probably number one reason with chiropractic care in general. So like what could be the cause of the low back pain? Like there's lately I feel a lot of people are just sitting in bad postures. And if you're working from home, things like that, that could be causing it. Again, it could be something traumatic. It could be stressful. It could be the way you sleep at night. I really feel like posture is like a big thing lately that I've noticed. And so what we do is we assess like where the problem is. And then a lot of times what we do is we line up the spine. And if you haven't been to a chiropractor, for anyone listening, that's like when we actually push on the spine and like pop and move it back in place. Or sometimes I use a little tool called an activator. It makes like a little clicking noise like that, and it gently pushes the bone back in place. So there's actually 200 techniques to fix a low back. It's just like finding which one works the best for you and then what your practitioner is good at. So there's about 5 techniques that we do at our office that we're good at doing. So we stick to those and we find like what works for you. I have some patients are like, I don't want you to push on me. I don't want to feel it pop. Great. Okay, I'll use the activator. Others are like, I want to hear everything pop and move. And okay, I will push straight down on you and we'll pop things back in place. So the difference between me popping your back and you popping your back is I actually push the bones back into the direction they need to go to be fixed, as opposed to just making a bone pop and releasing an endorphin. So like we always see teenagers come in the office and they're like popping and snapping their neck, and yeah, that's great. It makes noise. You feel that temporarily endorphin release, but it doesn't actually fix the problem where the bone's out of place and pinching the nerve. So chiropractic's about like finding the root problem and fixing it. So Vicki, I hope that helped. It was a long-winded question because I'm so excited about chiropractic care. I just want to give you as much information as possible. So Vicki, I'm going to spin the wheel for you. Starbucks, Vicki, I will reach out to you on Facebook and get you that Starbucks gift card. Thank you so much for watching. And if someone's watching this on the replay, comment below if you have any questions. Always happy. And I love doing this, so I'm sure we'll do it again soon. Ask your question and have an awesome day today.